What are the root causes of knee pain? We're gonna go ahead and let you know today. All right, so there's so many aspects to knee pain, and there's so many different ways a person can injure, and we can't predict an injury. That's one of the things that you hear all the time. It's when we do exercises and when we do strengthening exercises for the knee, it talks about reducing the risk of injury, right?
Yep.
But in essence, we can't predict when you're gonna have some type of knee injury. However, we do like to talk about regional interdependence and how the knee might be overutilized or underutilized in a way that can create knee pain from a biomechanics standpoint.
Yes,
right?
yes.
We always talk about pain, and there's so many different aspects to pain that could be involved. There could be a psychosocial factor, there could be a dietary factor, there could be a
Biomechanics.
Yeah, there could be a biomechanics problem,
Yep.
or there could be an arthritic problem, an autoimmune disease, so on and so forth. But today we're going to go over a simple regional interdependent problem, and that's really the root cause of it, right? Is regional interdependence, and we want to talk about this this term as a way of first of all, let's go ahead and describe exactly what's going on. Regional interdependence is the philosophy that each joint relies on the on another joint in order to increase movement. So if I had a problem with my ankle, I can have some knee problems, right? My knee is going to have to move a little bit more for my ankle, and we alternate in an area of mobile and stable joints, whereas a mobile joint is an area where we can create more movement, and our ankle, for example, can work in many different planes. We can, roll it around in a circle. We can do dorsiflexion, plantar flexion. We could do inversion, eversion. We can do a lot of things with that joint. Whereas essentially a stable joint, which is our knee, for example, is, even though there's a mild rotation there, it's simply a hinge joint, right? There's not a lot of movement, there's not a lot of freedom from a joint of our knee, whereas our hip, on the opposite end, is going to be more of a mobile joint because it's a ball and socket. It has more range of motion, it has more function, flexion, extension, rotation. It has adduction and abduction, right? So it has a lot of different aspects that we can utilize from the hip aspect. So simply put, regional interdependence, if our knee is being utilized more in a way that creates more movement than what it wants to do, which is simply just hinge and mild rotation, we're gonna have some problems with the knee, right?
Creating more stress on it.
Exactly.
Yeah. That's because a lot of times, right, because of that same concept, the lack of maybe movement from the other joints may be causing it. So now your knee's doing more work.
Exactly.
Simply put.
And so when we assess our patients inside the office here, we look at the range of motion, we look at the ability for our hip to do work, whether it's stabilized, mobilized, whatever it is, and our ankle as well. We want to make sure that it has its full range of motion, its full mobility or control of those areas in all aspects of its motion.
Yep.
And then we see how much the knee has to excessively work for that.
Right.
Because if there's a problem along the chain of command that goes from the feet all the way up to to our head, we're going to be dealing with some type of pain in our knee, right? And if it's a hip problem, it could be affecting the patella. It could be affecting the way the knee rotates. And we just want to retrain your body to be able to manage load. And that's what it really comes down to, is how do we get your body to manage load, whether it's your own body weight, whether it's an excessive load or a constant repetition such as running. We need to figure that out, and we need to find out where the cause of the dysfunction is coming from, whether it's above or below the joint. If you have problems with your knees and you want to learn more about it, check out this playlist right over here.